Thank you, Abby, for this introduction. And good afternoon, everybody, and thank you very much for attending our webinar today. Before starting, I just would like to tell you a little bit more about myself. So my name is Benoit, and I'm Project Director at Scheme. And basically, I'm heading our Consumer Health Division. As Abby mentioned earlier, Scheme operates in different industries. In our Consumer Health Department, we actually bring together our expertise in healthcare and FMCG together to provide market research insights to consumer and pharmaceutical companies offering health products. Based on this market research insight, we actually provide recommendations to our customers across our 3 pillars of expertise: new product development, communication, and pricing. And during the course of this presentation, I will mention specific examples falling into these 3 categories. We therefore focus on products such as OTC drugs, dietary supplements and functional foods, and of course infant and medical foods that we are going to discuss further today. To give you a little bit more background about our expertise in this specific area, over the past 3 years we have performed more than 50 projects in the area of infant and medical foods, which helped us gather a thorough understanding of this industry, but also of the challenges that marketeers and market researchers face in this area. But before starting with the core of our presentation, and because there is often some confusion about what medical food exactly is, I just would like to briefly explain and define what we mean in this presentation with medical foods. So medical foods, also known often called medical nutrition, are basically foods that are specially formulated and intended for the dietary management of a disease that has distinctive nutritional needs that cannot be met by normal diet alone. So medical foods are basically different from dietary supplements and functional foods, enriched with nutrients, because those offer health-promoting properties but are intended to the general population, as opposed to medical foods, which is specifically designed and formulated for the management of specific diseases. So to illustrate this definition, I just would like to quote some examples. So for instance, we have Boost Glucose Control or Glucerna, who have been developed for the dietary management for type 2 diabetes patients. We have FortiFit or Ensure that are products designed for elderly patients suffering from sarcopenia. Sarcopenia being the conditions in which they lose their muscle strength. We have also Axona, which is designed more for the needs of Alzheimer patients, for instance, or other more medical-looking products, as you can see on these pictures, such as Deplin, Fosteum, and Limbrel, focusing on other areas such as osteoporosis or arthritis. Okay, so why talking about medical foods today? Well, this specific market is very interesting because it's, first of all, because it's growing. Actually, the demand for medical foods is driven by several factors, one of them being an aging population, but also the increase and more systematic diagnosis of diseases such as dementia, diabetes, or cardiovascular diseases, but also advances in food technology, which means that more and more food can address effectively various conditions. But this is also a market that is really evolving rapidly with, for instance, changes in reimbursement status and an increasing importance of the end consumers in the decision-making process. This is actually something that we'll cover a little bit later in this presentation. So the question we'll address today is how to effectively use market research in such a complex and changing environment. So to address this question, I will basically review 4 main specificities of these markets and address what are the implications in terms of market research considering these main characteristics. Okay, so let's move on with the first one. Basically, across a number of studies that we've performed, we often observe that there is really a lack of awareness of medical foods and its benefits. Let me illustrate that with some examples. So first of all, thinking about consumers. When presented with a new product, consumers often ask this question: what is it? So basically they don't have like only one question, but they really have a multitude of questions regarding this product. The questions they may have are related to the efficacy. So is it actually effective, medical food? What can I expect from it? But also how to use it next to other therapies. So what makes it actually different from a regular diet and from a drug, which are basically the things that they are aware of and that they are most familiar with. Is it an alternative or a complement to drug therapy? Is it safe? In addition to safety and efficacy, they also have a lot of questions with regard to usability. So how should I integrate it into my my daily conceptions? Where can I find it? So many questions that are always rising from such products simply because they are not aware of the product category. What we also observe is a lack of awareness among the medical profession. Traditionally, medical foods has been recommended and prescribed by dietitians. But what we observe with a wider range of conditions being targeted by medical nutrition is that more and more specialties are now being addressed. This goes from nurses to general practitioners, doctors, and even specialists. The fact is, these different healthcare professionals have a very low awareness of medical foods and its benefits. So they often ask exactly the same question as consumers in terms of efficacy, safety, but also usability for them to determine how to best use this product and when to best recommend them. Actually, a common factor between these consumers and these healthcare professionals, and mostly due to this lack of awareness, is that there is often some skepticism with regards to the efficacy levels that can be achieved with medical foods. And there are two factors that are actually driving this skepticism. The first one is that medical food is addressing a wide range of conditions. And for certain conditions, like the more severe these conditions are, the more skeptical both consumers and healthcare professionals are. The second factor is that there is not always a clear link between nutrition and some of these conditions. So for instance, it is well known that osteoporosis or diabetes are clearly linked to nutrition. So both consumers and healthcare professionals are educated and know that by a food or a nutrition product could have an impact on these conditions. But this link is less clear and less prominent for other conditions such as depression, dementia, or chronic fatigue syndrome. In that case, it increases the skepticism of the population toward these products simply because there is no clear association. Okay, so it's clear that there is a lack of awareness in this market about medical foods. But what does it imply for your market research? Well, I would like to use here like the example of a new product. Since there is a lack of awareness about a category, we often recommend to adopt a two-step approach when evaluating a new product. Starting by thoroughly evaluating the awareness and perception of medical foods, so the category, and then the perception of is a medical food concept. Why is that so important? Well, one of the reasons is that healthcare professionals, for instance, can be like quite critical towards a new product, not really because of the efficacy levels or its product profile, but simply because they are not aware that what medical food can do and can be very skeptical towards it. So sometimes they could be extremely critical towards a product and even, I would say, unfairly critical towards the product, simply because they are not ready yet to incorporate medical nutrition in their recommendation patterns and in the tools that they may use. So what we sometimes and often actually recommend to our clients is to evaluate the awareness and perception of medical foods first, and sometimes even just dig deeper and focus on the audience that is more open to medical food to determine the perception of a specific concept. Of course, it is crucial to monitor the number of healthcare professionals or consumers that completely reject the category, but like the marketing issues that are behind it are much wider than the one of a single concept, and more education towards the entire category needs to be done. So of course it's important for your marketing team to be aware of this, but for the purpose of evaluating a single concept, it could lead to unrealistic results. Okay, a second takeaway of this lack of awareness is that for you to collect actionable insights, you need to make sure that you describe your product really in detail. So as we've seen before, both consumers and healthcare professionals tend to have a lot of questions about these products. So for you to collect insights during your research that goes further than I would maybe recommend it, I would maybe use it depending on X or X factor, it is much wiser to provide them with all the relevant information that they may have related to, of course, the product itself, its mode of actions, but also its efficacy, safety, or even its usability. Only then you will be able to get really useful, reliable, and actionable insights with regard to your specific products. Okay, so this is with regards to our first insight. Now, as I mentioned already, I'm talking about both consumers and healthcare professionals, and I would like now to focus more on your target group in this market. So what we see is that in the medical food market, consumers are more and more important in the decision-making process. There are three factors that are driving this trend. First of all, consumers are simply more knowledgeable about diseases, products in the market, and therefore have more access, well, because they have more access to this information, for instance, through the internet. So they therefore are also more critical towards these products and tend to challenge their healthcare professionals' recommendations whenever they have like some information, gathered some information on their side. The second factor is that overall we observe that there is less and less reimbursement when it comes to medical foods in general. So this means that the end consumers have to pay for the product himself. So if he considers that this product is not affordable, he has the opportunity to seek for cheaper options. So this means that the consumers become more and more important in the decision-making process. And thirdly, there is also an increasing number of medical foods that are made available in the mass market, increasing the accessibility of consumers directly to these products. Of course, overall, this remains medical foods, and most consumers would talk to their healthcare professionals before taking it. So our second insight here is that both healthcare professionals and consumers are involved in the decision-making process. Okay, so what does it imply for your market research? Well, the first step may seem obvious to you, but it's actually something that we see being very often overlooked by our clients in this category. The first step is really to find out what the decision-making process is. So who is actually an influencer and who makes the final decision? So across the different studies we've performed, we observe that this is often clearly linked to the indication area in question. So for some conditions that are less severe, or for chronic conditions, then consumers are more educated, but they are more confident with self-diagnosing and also with self-medicating. So they would tend to have more importance. For more severe conditions, then they really rely on their healthcare professionals because they are often concerned about potential safety issues and also to know how they should adapt their current drug therapy, for instance, accordingly. Okay, but once you find out the actual decision-making process, it is crucial that you keep on taking it into account, not only in your marketing approach, but also in further market research that you may conduct. So you need to replicate as close as possible from reality the buying decision process when assessing, for instance, the potential of your product. As mentioned at the beginning, one of the key areas of expertise of SCIM is pricing. So here on this slide, you can see an example of a pricing exercise as we would perform it, and that is basically addressed to consumers, in this specific case, consumers that would be suffering from type 2 diabetes. You can see here that in this exercise we provide different products to consumers, and each product is defined with certain criteria. So in that case, for instance, the name, but it could also be like the claim and the different flavors, and of course the price, because this is what would be interesting to evaluate in this specific situation. But as you can see on this slide, because healthcare professionals can have a strong influence on the choice, we also integrate the recommendation by a diabetic nurse or by a pharmacist in this choice. Because in reality, a consumer may follow his, for instance, diabetic nurse recommendation until a certain price is reached, which is basically a key threshold for them, and then decide to go for a cheaper option. So actually not taking into account this recommendation could lead to an underestimation or overestimation of the price sensitivity, which is critical to take into account to collect actionable and also realistic insights and develop a strong pricing strategy accordingly. Okay, so let's move on to our third key insight. So basically, depending on the indication area and the clinical benefits that your medical food offer, healthcare professionals, but also consumers, may compare you to a wide range of products and product categories. And this range is often wider than medical food only. There are actually two reasons for that. The first one is the nutrition nature or the food nature of medical foods. So basically, more naturally, both consumers and healthcare professionals will link it to, associate it to what they know, which is food products. So more naturally, they would compare them with functional foods or dietary supplements, but also sometimes even to like a healthy diet. And of course, medical foods is also really specific and offering clinical benefits. And in that sense, they often this often creates head-to-head comparison with drugs. So what is important to keep in mind about this category is that medical foods are competing with various other products, but may also compete with different product categories. Okay, so what does it mean in terms of research? So here again, at first sight, it may seem obvious, but it's really critical to investigate what you are exactly up against and to remain open-minded with the fact that you may be compared to products that you think are extremely different from what your medical food products are. So it is crucial to first clearly map the different products that you are up against. And secondly, again, it is important to integrate this broader competitive field into your research. So to illustrate that, I will use again our example of a pricing research. So here again, you can see on the left side, like the different products that would, for instance, be available at a pharmacy. However, imagine that in this specific case, we found out that often consumers associate it or compare it with low in sugar products. Of course, we all know that they deliver different benefits, but there is a strong association between these two type of products. So in your pricing exercise here, it is important to both show like the two categories and to see whether at some point consumers would switch from a medical nutrition product to another product simply because of the fact that, for instance, medical food products could be too expensive for them to afford it. Again, here it is very important to take this wider competitive field into account, because it is crucial for you to make sure that your strategy takes into account this wider competitive field and clearly position your products as a superior option to work compared to this other and wider competitive field. Okay, so let's move on to our fourth characteristic of the medical food category. Basically, one of the most important things to get healthcare professionals and consumers to act is to convince them of the clinical or health benefits your medical food offer. This is a prerequisite. But even if healthcare professionals and consumers are convinced that your product offers them a relevant benefit, there are always other forces at work, such as concerns about taste, or a lack of convenience, for instance, or a high price, that would prevent them from trying or repeating its usage. So of course, ensuring compliance for such products is really key, since most of these products need to be used over a long period of time. So ensuring that these products are not only beneficial in terms of clinical and health benefits, but also there is no barrier in terms of taste and convenience is really key to ensure long-term usage and to make sure that you have a strong basis for purchase, for repeat purchase. So of course, the first consideration here is that you need to develop products that have different benefits. And this is our first insight here, is that successful medical foods provide multiple benefits. So of course, the first step is to develop products having different benefits, but the second step is to communicate it effectively. And before going into like the implications in stuff of market research, I just would like to use an example to illustrate how companies can both focus on like the health benefit, but also addressing their communication potential barriers for usage. You can see on this page the example of not of a medical food, but of a dietary supplement, which is Benoit. And you can see in their communication that they both show the health benefit of Benoit. So I will just read it for you because I'm not sure that you can read it well. So Benoit aids your digestive process, so you can better absorb some essential minerals your body needs, while getting rid of the toxins it doesn't. So it clearly explains in a consumer language what the product does. But what you can also see quite prominently in their communication is that they also address potential barriers that could prevent consumers from using this product. So in that case, the fact that it's clear, taste-free, that it dissolves easily, but also directly unpack the claim mentioning makes taking fiber easier. So the communication is a balance between triggers and alleviating and reassurances towards the potential barriers. So basically the key, what is key to do here in the medical food category, more than in other category, is to develop a winning communication to make based on triggering your audience, but also on overcoming potential doubts. So you can see on this chart that upon the introduction of a certain product, the first prerequisite is whether your target audience like the benefit. So in that case, it will most often be the health benefit. If not, then your audience is simply not reached. The second step will be to overcome potential doubts, such as taste, convenience, or price. The third step will be, are they willing to pay the price you have identified? And if all of this is properly addressed, then your product is sold. If not, your target is not fully reached. And this is actually exactly the stepwise approach that we are using when conducting market research in terms of communication with our triggers and barriers approach. We basically mimic a conversation between the brand and the consumer. So the first step is to identify which characteristics trigger them to use a product. The second step will be to define potential barriers that prevent them from using a product. And then our third step is to determine potential benefits or characteristics that could reassure them to the extent that the barrier can be overcome. And based on this stepwise approach, we can determine how and to what extent your audience can be reached in your communication. In addition to this, actually, SKIM is one of our core area of expertise is communication, both amongst consumers, for instance, with claims testing, and with healthcare professionals with detailed aid testing. Over the past 5 years, we've performed many research in this area, which allowed us to get a thorough understanding of what are the criteria that makes a winning communication. So here you can see on this slide some examples of winning communication. We have actually made a webinar last year really focusing on this approach, and we invite you to look on our website by searching for webinar effective communication for reviewing or viewing this full webinar. If you don't find it, feel free to contact us and we'll happily share the link to you. Okay, well, we are coming to the end of our presentation, and just to sum up, what are the main points that I would like you to take away from this presentation, this webinar, is that medical food is really a complex and changing environment, which presents many challenges to marketeers and very changing challenges to marketeers. So this is clearly a specific market which requires really a flexible and tailored market research approach to collect accurate and actionable insights. Okay, well, I hope that you find this webinar helpful. I will be very happy to answer any questions you may have about what we've discussed today, and I'm also happy to discuss with you further your specific request. So feel free to contact me if required. Thank you very much.
Great. Thank you, Benoit, for a fantastic presentation. I think we have some time now for questions left from the audience. Just a reminder that if we don't get to your question, we'll get back to you personally by email to answer it. You can also feel free to reach out to either of us. There on the screen you have Benoit's email address, but also my own, in which you can reach out to us also by phone or by Twitter. So please send through your questions if you haven't done so yet. I have one question here, Benoit, for you. It says, you mentioned that it is crucial to understand the decision-making process and how patients and healthcare professionals interact. How do you generally determine this?
So this is a really good question. So basically, it will really depend on what stage your product is and what the exact business question is. We basically answer this question using two different approaches. It can be really exploratory when it concerns a new indication area, for instance, by understanding, by exploring who are what type of interactions there is in between consumers and healthcare professionals and understand like who are the different healthcare professionals, for instance, involved in the decision-making process. So it will be more a qualitative approach, really exploring the different interactions between consumers and the different healthcare professionals in question. But we also integrate that in further steps of the research. For instance, like in the screen I was showing, like in the case of a pricing research, we actually measure quantitatively to what extent consumers actually follow the recommendation of their healthcare professionals, and also which healthcare professionals they tend to follow more their recommendations. So there is really different approaches depending on your current knowledge about the indication area, and also depending on how far you are in the product development process.
Great, thank you. I hope that answered your question. Well, I just realized actually we've gone a bit over time. We wanted to keep it under 30 minutes, so I'm going to go ahead and wrap up. I want to thank you all for joining us for this webinar today. Please be sure to visit the link that's on the slide now, skimgroup.com/webinars with an S, to download the presentation and to get information about our other upcoming webinars. You can sign up there for the upcoming webinars that we'll have. You'll also receive an automatic email from me tomorrow with information about where you can download the slides or view it again on YouTube in case you want to share it with a colleague. And at that link as well, you can actually sign up for our next webinar, which will be in 2 weeks on April 11th. This one will be at 1 p.m. Eastern Standard Time in the U.S. with Juan Andres Tello. That's our regional director for the consumer field in America. And he will be giving an unfiltered look at the consumer insights process, so from 3 different perspectives, a client, a researcher, and a consultant. So I think that's it. On behalf of Benoit and myself, I thank you once again, and we look forward to hearing from you soon. Thank you. Goodbye.